Griffith for his 5 minutes of questions.
Thank you, Madam Chair. Ms. Ross, we try to get along on this committee. If you've got something short, say it.
Thank you. It's very difficult for me to hear the comparisons to other countries' single payers with the constant comment that people are dying and denied care. As long as the for-profit motive is present in this country, that's what's happening now. The only way for them to make their profit is to deny care.
Well, and I don't necessarily agree with you on that and would take exception, but we do try to be courteous on this committee and try to work together. That being said, Dr. Atlas, today many rural hospitals are closing because they cannot afford to stay in business, leading to access problems for sick Americans. One of the major reasons for these closures is that Medicare, and Mr. Kennedy mentioned Medicaid, doesn't pay hospitals enough. According to MedPAC, hospitals are unable to make money caring for Medicare patients. If it wasn't for privately insured patients, even more hospitals in rural communities would close. Research by the consulting firm Navigant predicts that a Medicare public option plan would put up to 55% of rural hospitals at high risk for closure. Now, I say this with the backdrop that my rural Western Commonwealth of Virginia district has lost 2 hospitals in the last few years. We're trying to get one of them back. But many of the plans we are discussing today involve expanding Medicare. If more patients are covered by government health care, won't that lead to even more rural hospital closures and access problems?
Well, absolutely, of course. Like I said before, the CMS actuary put out the statistic that, and in fact a statement that we expect access to Medicare participating physicians to become a significant issue, quote unquote. And the reason is because Medicaid and Medicare pay not just lower than private insurance, but below the costs of delivering the care. That's the point. And so it brings you back to what I believe is the whole solution that should be the focus, which is to reducing the cost of care without needing to limit or restrict the use of care. If you reduce the cost of care, everybody gets access, including those on government programs.
Yeah, and I appreciate that. And I guess, the question is begged, how can we guarantee access to care for patients in rural areas under Medicare for All plan if there are no open hospitals in rural communities? And for those who haven't heard me say this before, sometimes you look at a map and point A to point B doesn't look like it's very far, but when you have a mountainous district like I do, it may be Hayside to Dickinson. The mayor of Hayside plans on an hour if he's going to a meeting in Dickinson for travel time. And the same is true when we closed down the Scott County Hospital. That meant a minimum of 45 minutes to an hour for many of the people in Scott County to get to the nearest hospital just for basic stuff, not even counting something that might be more complex. But how can we guarantee that those folks are actually going to have care? It's not like getting in a cab and going to the next hospital down the road. There is no hospital down the road.
Well, again, the solution is to introduce the forces that bring down the prices for every other good or service in the United States. That's how you ensure access, not just based on price, but based on value or quality.
Dr. Holtz-Eakin, anything to add to that?
I think that's the essence of it. I don't think anyone's here to defend the status quo. The question is, how can you go forward and what set of reforms would deliver a downward pressure on delivering the cost of quality care?
I appreciate it. With that, I yield back. Thank you.
The gentleman yields back.